This is poor Crystal. Look at her eyeball. Look at her eyelid. How swollen it is. Hi, Crystal. Look at that. It's a big swollen bite or infection, and we're gonna get in there and see what it is. But she's a very good dog. Look at how sweet she is.
So we're putting catheter into Crystal because we're going to use IV anesthesia, propofol, which is a short-acting anesthetic. And then so we can go in there and probe and flush all the pus out and probe, like I said before, to make sure that there's no foreign object in there and to clean out all the junk.
So what we do is, in order to make sure it's an abscess, we'll put a needle in there and we'll draw out pus, which you see the pus come out. Ew. Ew. Ew, that's pus. We can look at it under a microscope slide, but there's nothing else that looks like that. And then I'm gonna put the stab wound right into the heart of the abscess with a blade. Look at that. Ooh, ooh, ooh. Now I'm gonna let all the pus run out like a little red river. And then we're gonna flush it out, and then I'm gonna stick an instrument in there and see how far the abscess goes. So you can see how deep it is. Even though the eyelid's usually very thin, this abscess, if I use that as a guide, it goes all the way in. And I'm looking now I'm gonna kind of loosen up the tissues in there, see where the hole goes. It kind of goes off in this direction. So sometimes I'll take a piece of gauze and I'll wrap it around the instrument to see if there's any foreign bodies, any what we call foxtails that occur in California. The gauze will sometimes pick them up.
With a long instrument like an alligator forceps, I can go all the way back. It's even farther back than I first thought. It goes near the back of the eye, and could be that a foxtail got in there, or a piece of wood, or it could just be a bite, or like a spider bite, or a bug bite, or a cat scratch bite, or a cat scratch or a bite. And it could be causing a big abscess, but we really probe way back there to make sure that there's nothing back there that can keep the infection going.
And then we'll flush out the wound really good with see if anything comes out. Then I see how far that pocket goes, and if I can make it exit to the outside. Because if I can do that, then the pus won't collect in there. So I'm going to make this hole where I feel my instrument. So I made a hole in the skin, and then I'm going to poke my instrument through like that, and then I'm going to open the instrument. And then I'm going to put my drain in there. I'm going to pull it through, and now the drain is in the abscess pocket. The fluids don't drain through the tube, they drain around the tube. So this drain now will help this abscess drain through from deep around the eye instead of infecting the eye or causing problems. So now we're going to put the suture through the drain, and then through the skin, and suture in the drain to the outside using our square knots. Whoops, excuse me, Mr. Cameron. Hope I didn't get blood on your lens. And then that one's sewed in, so I'm going to sew in this one, this side, because if we don't sew it in, guess what? It'll come right out. Isn't that ridiculous to say? Of course that's true. But I'm going to make this a little more doggy proof. We're gonna put another suture. I'm glad we did this. This poor doggy first I thought I would just use antibiotics, but I didn't realize it was so deep behind the eye. So in this case, doing surgery really will help this heal. I'm not saying we do surgery unnecessarily, but remember, we don't know what we're going to find in there. This big area is now flatter, and I always check the eyeball itself to make sure that there's no damage to it, because you can't really see it when it's so swollen. But let's see if I can show you guys out there in YouTube land. So I'm going to pull the membranes away. See, that's a third eyelid. That helps cover the eye and keep it washed off, but it really swells up. And that's the cherry eye gland. That's called the Harder's gland. Look at it pop out there. Harder gland, go in. Come out, Harder gland. There it is. But now this is a cherry eye gland. This is the conjunctiva of the eye. Let's get the eyelid down. So that's the third eyelid. That's the cherry eye gland, or the Harder's gland. This is the conjunctiva of the eye, and they're all swollen because of the infection all through the tissues. You won't usually see them that red. But see how the eye itself is nice and clear like a window, and it's not grayish like an ulcer would be? I'll quit tugging on it now. Get back in there, Mr. Harder's gland, or Miss. You can never tell which sex they are. Anyway, so that's what the other eye. Look at how those membranes don't look nearly that swollen. See that? And how that eye's a nice window pane. So that's what we look for. And then if we were to look at the Harder's gland in this eye, it wouldn't be, wouldn't be nearly as swollen. Let's see. See, it doesn't come out as much, see? So it's just because that eye is swollen, and sometimes the inflammation will drive it. Wait, so we're gonna clean that all up so the owner doesn't faint when they see all this blood. And this dog should be much more loving now, because they say abscess makes the heart grow fonder.
So the major thing you want to know if your dog has a swollen eye is the eye clear like the one we showed you on the other side of this injury? Are they squinting the eye? If they're squinting the eye, it's probably best to get it checked out, because that means that it could be very, very painful. And in this case, the abscess of the eye can be caused by a puncture. Say, what if this sweet little dog ran into a stick or a piece of wire? It can be a cat scratch. Cat's claws contain many bacteria that can cause an abscess. Could be roughhousing with another dog that caused a bite wound of the eye and caused the abscess. Could be a wasp sting or a spider bite, which will cause swelling in an abscess. It could be a foxtail. In California, we have many foxtails that can go up under the eye and into the eye and cause that abscess. I didn't feel or see it in there. We probed quite a bit, but it wasn't evident. But it doesn't mean that it's not way deep in there, and it might have to be totally opened up and search for. But we usually wait for it to come to a head, because it's hard to find it when there's so much swelling and so much serum and pus, and there's a risk of other tissues getting infected if we mess around in there too much, especially the eyeball itself. Could be a piece of wood, a wood splinter, that also could cause it, or a thorn of a rose bush. So many things can cause the eyelid problems. If your dog has something like this and you're reasonably sure the eye itself, the eyeball or the cornea looks clear, you could use an aspirin the night before, or to make the swelling go down. And you can always check for dosages on Dog Dish Diet. I have a Dr. Greg's Practical Home Remedies, and it has dosages of aspirin. You can also hot pack any abscess, and it will make it come to a head. And once you can get that to come to a head, then it will drain, and it will take the infection away from inside and put it on the outside. So those are all things that you can do. Aspirin and drain it. Now, dosage of aspirin is at my site, Dog Dish Diet, and also it's 325 milligram aspirin per 30 pounds, and then a small 80 milligram aspirin you can give to a 10-pound dog. So anyway, check out Dog Dish Diet. I have my books for sale. If your dog has allergy problems and ear problems and bladder problems and seizure problems. It's worth a try to get the diet as good as you can. Even if you need medication, sometimes a good diet can decrease the need for medication and also cause much better results with the medication. So anyway, have a great day. Check out dogdishdiet.com and take care of your pets.